Hey everybody, how's it going? We're on Drumming Injury Talk with physical therapist Janice Ying, coming to you from the LA area. I'm way up in the mountains away from the commotion, 100 miles east of Phoenix. How are you, Janice?
I'm doing well. How are you?
Doing great.
It's nice to see
I
you.
nice to see you too. I actually have a new ailment to tell you
Uh-oh.
about, to get your take on, but I first wanna let everybody know, in case they're not seeing the ticker or reading the description, what the heck we do. Well, drummers and other musicians, as Janice can attest to in her work and as a musician herself, suffer often from repetitive motion industries, and drumming being the most athletic, going everything from the fine motor movements of fingers all the way to limbs flailing and whatnot. We're talking about things like bursitis, tendonitis, arthritis, uh, shoulder arch pain, hip displacement, joint pain, sciatica, things like that. And if you folks think you may have or know you have any of this, feel free to chime in with questions, or feel free to chime in with how you got past something with the help of a physical therapist like Janice. Did I miss anything? Did I leave anything out?
No, I think you hit it. That's kind of like my bread and butter. So I love talking about these things. I could talk all day, but I think people would start to glaze over a little bit if you get me down a path.
Well, let's talk about something in my world, and I'm not sure if this is from drumming. Um, I know what caused it about 30 years ago. When I was in my 30s, I had bursitis right here.
Mm.
And
Mm-hmm.
the way I found out it was bursitis is kind of interesting. It out of nowhere swelled up like a little
Yeah.
tangerine. And I thought I got bit by a poisonous spider or something, but I couldn't find a nick or anything. So I went to the emergency room and they deduced that it was bursitis. They drained it and it was fine. But the way I got that was a repetitive motion industry injury of doing this with a tape measure, because at the time I was on a break from music and I worked at a very, very large carpet and flooring store
Oh,
in the LA
interesting.
area. Yeah. And I was doing like estimates
Man
for
of many talents.
yeah, and I was working with like contractors, interior designers, things like that. So that constant motion of pulling out I'm ambidextrous too. So I didn't do that with my right hand. I held the tape with my right and fed it out with my left. And that made sense, but I don't do that anymore. And I'm not sure what else that's from. And honestly, I'm kind of embarrassed to say this, but I don't drum often enough for me to think that the injuries from that. So I kind of want to weave that into the conversation with your expertise of
Yeah.
repetitive
I think
motion
that's
and
a
frequency. What can cause an injury? Like how frequent does it need to be or not?
I think that's a really important point because oftentimes people come to see me as like, yeah, it's like playing related or whatnot. But I always ask them, like, what do you do in your off time? Like when you're not playing, what do you do? Because that stuff could very much also contribute
Yeah.
to kind of like the bigger picture, even though they might feel it when they play. But
Could be a
people
golf,
are
it
on
could
their
be
well,
woodworking
people are
or
on their phones all the time and they have
gaming.
like
Yeah.
carpal tunnel syndrome. It's like, okay, well, I'm on my phone like 6 hours a day, and then I practice like 2 or I'm playing 2 to 3 hours a day, like, that the phone is the problem, not the drumming or, like
Interesting.
so it's really interesting that you bring that up, um, and, when we talk about, like, bursitis, do you know what a bursa is?
You know what? I don't remember. No, talk about that, please.
Yeah.
'Cause this was again like
So
30 years ago.
so
I
so
don't remember.
bursa are, kinda like the way I like to describe them is like they're little, like, fluid-filled sacs. And so if you
Oh,
imagine, like, you put some water in a balloon, but you don't fill it up all the way, but it's kind of like a squishy pancake kinda
yeah.
thing, that's what a bursa is, and you have them all over your body, and they're supposed to be kind of like shock absorbers or like little cushions around like areas of friction for
Oh, wow. I
either
never
your
knew that.
tendons or like a joint. So you have bursa like in your elbow, in your shoulders, on your knees, in your by your hips, etc. And any one of those things can get inflamed or irritated and cause more swelling in the area. And so for
Oh,
you doing something repetitively, it could be that, because you're moving through this, you also have like tendons and nerves that are also moving with that
right.
motion too. And so maybe potentially like way back when it was causing some friction in the area that irritated the bursa, so it like blew up, right? And so a common area that people will get bursitis is like on their hip, like on the
Right.
side of their hip. If they like lay down on their side or they cross one leg over, you have a little
She's eating my
visitor.
plant. She waited till the show to come in. Come on. You know
That's
better.
funny.
Okay.
We have a guest. We have a guest star.
Yeah. You just can sit here, but you can't eat my plant. Okay. Sorry.
No, it's all
That's
right.
interesting. That does relate back to then. I just don't know what the heck is going on now.
Yeah, it could be. Oh, one other thing, especially when it comes to the elbow, that a lot of people do that can flare up the bursa that they don't think about is if you sit on your desk or at a table and you're putting weight through your elbows. If you're like
Yeah, that
resting
I
your
don't do. Yeah. Thinking at the dinner table, I don't think I do. I think my wife would yell at me. And I don't have room to at my desk. My keyboard,
yeah,
between the edge of my desk and keyboard's only like that much room. I'm pretty
got
close.
it, got it.
So that's
Yeah, so it's like little things like that. Like if people have symptoms where they're like getting some irritation of the bursa, you also have a nerve that goes right, like your funny bone.
yeah.
So do you know why it's called the funny bone? This is a
I guess
anatomy joke. It's not. It's true, but like,
because of the effect of when you bump it and that weird.
well, when you bump it, it's not so funny, right?
It's
You'd
not.
probably say like a couple like curse words or
Yeah.
whatnot.
I have 8.
Yeah, but this bone here, where the nerve travels behind, is called the humerus.
Oh, that's
It's a
right.
humerus bone.
That
Yeah, so that's why it's called
makes
the funny
sense.
bone.
Awesome. Yeah, I
So,
injured this one. You're like even long before then. It's funny that this never had any major problems other than it's very sensitive. My elbow came
yeah,
down on,
ouch.
what you would set a pot on the stove. It came
Yeah.
down on a burner like really hard, and oh,
Ooh,
it
ouch.
was horrible. And even
Whew.
today, if I touch it like that much against something, it goes zing, and it's
Yep,
not funny.
yep. No, it is not funny.
Now
So,
that you mentioned, though, about the
yeah.
pressure thing, I'll have to pay
Mhm.
more attention to what am I doing with this elbow that I'm not doing with this one, because it's not in both elbows. So that's interesting. I'll have to think about that. And regarding frequency of a repetitive motion, if I'm playing drums only 2 or 3 times a week for an hour at a time, is that enough to cause a injury that sticks with you? It doesn't sound like it, but what do I know?
It typically not, but it could depending on the conditioning of your body and your tissues. Like if you've been consistently playing, a couple times a week and you like that hasn't changed, then probably it's not the bigger contributing factor. But if you've taken like a month off or 2 months off, and then you go back to playing 2 to 3 days a week, that
Oh,
might be enough to cause repetitive stress
interesting.
injury.
Okay.
And that's common, like, that's it's pretty common, like, a lot of times when musicians have pain, they're like, "You know what? I'm just gonna take time off, the pain will go away." But then they go back to playing exactly how they were before with all that rest before it, and oftentimes that'll, like, re-exacerbate their symptoms. They're like, "Oh, the rest didn't work. I got worse," or,
But they
things
just dove in. They didn't ease back
they
into it like any other
exactly, and that's
athletic
yeah.
thing. Yeah.
Exactly, exactly.
Interesting.
I always compare playing music to being a marathon runner.
Yeah.
And so you think about how a marathon runner would train or how would they would prepare for running a marathon, whether it's a race or just for fun. Although
Mhm.
I would never run a marathon distance for fun. But there are people who do. Um, but, you wouldn't just, like, take a couple months off and then just, like, decide to go and run a marathon, like,
Right.
no,
You
that's
train for
not
it.
how you train for it, and
Yeah.
so musicians, I really hope musicians start to think about it within that same context.
Yeah, that's interesting. Okay, thanks for that. Um,
Yeah.
have you seen any specific cases lately that you can share that might help some people watching, whether they're watching live or on the archive? And if you're watching live, tell us where you're watching from. You can tell us on the archive too.
Yeah, I mean, I see people with all sorts of shapes and troubles and whatnot. Probably one that I have recently seen. So I do see a lot of drummers, but I also work with all other musicians, all other instrumentalists as well. So I had a cellist who had some nerve problems when they were playing, and so it was just a matter of like figuring out where the nerve was getting stuck in their upper body and trying to get it to move again.
Was
So
it in their bow hand or their fingering
it was
hand?
in their fingering hand.
Interesting.
Um, yeah, and nerve issues are a pretty common thing that I'll see, in addition to kind of repetitive stress issues too. And so what we do is we try and look at kind of like their setup. So just like drummers have a setup, cellists can have a setup too. And usually it's like how long their end pin is, like from the, like
Hmm.
how high off the floor the instrument is from. And so that will also affect kind of like how they position their arm and whatnot. Is it down low?
Right.
Is it too high? So maybe trying to kind of modify things a bit, if they feel comfortable with that, to try
Interesting.
and take some of the tension off of the nerve. So there's a lot of stuff that we also did, but that's kind of an area that we did talk about.
Yeah, interesting. Also on those instruments compared to, and when I say plural, I mean also like the double bass, concert bass, the amount of pressure it takes to press on the strings is totally different than playing a
Y-
guitar or a mandolin or a banjo or something.
Yeah, yeah. So the action in itself is different, but you just like with the guitar, you can modify the action to a certain extent,
Right.
right?
Yeah.
So like with cellists and violinists, like of course they would need to collaborate with their luthier, with their the technician, I guess.
Yeah.
And so you can change like the height of how far the strings are off of
Hmm.
the fingerboard and whatnot. That's probably like a last ditch effort that I would normally recommend to people because it is quite an overhaul for a lot of them.
Yeah.
But it
Yeah.
is an area that could be modified if it
Cool.
needed to be.
And I want to
Yeah,
give a shout out to a couple people watching. We've got Andre Small in South Africa watching us on Facebook. Thank you very much.
very cool.
And yeah, Alfredo, Borja, or I don't think it's Borgia. I might be wrong, Borja. But either way, thanks for watching from Pennsylvania. Not sure what country that's in, but I'm just thanks, guys. Tell your friends. And again, for everyone watching, let us know if you have questions, because especially while we're live, Janice is right here to answer those questions for you. And we'd love to hear some people's different scenarios, because when you ask a question on this show and Janice answers, you're helping other people as well. Again, way back when, how old was I? It was around the time of the bursitis thing, but totally unrelated. I bulged 2 discs in my back really badly, and
Mm,
I don't remember which ones, but I had sciatica really bad for 10 years. I walked with a
ouch.
cane for the first 3
Oh
months,
my
and
gosh.
I was like 32, 33, something like that.
Yep,
And
yep.
it was so debilitating.
I can
I could not
imagine.
play whatsoever during that time period, but it got to a point where I just had sort of like more so a low lower back dull pain. And it's funny, the only thing that didn't hurt was when I played, when it got to that point. I don't know if it had
Yeah.
to do with my posture or my mind was just so off of it, or what, but I thought that was interesting.
Yeah. Yeah, that's super interesting. Yeah, around 30, 40 is when like disc bulges or disc herniations occur the most. Once
Oh
you get
wow.
older, you have other back issues that
Well,
can creep up.
hopefully that's far off from me, even though I am
Yeah.
twice the age I was then. But let me ask you this about that, because I've always been interested in what does happen in different phases as we age physically. I'm certainly not going to be modeling any underwear, but I think I'm in pretty good shape for, I'll be 61 in a couple weeks. But what is the most common cause for a bulge disc? Is it just bad lifting habits, overextending? Is it, and then I'll tell you what my fun story was on how I did mine. It happened in a split second.
Oh, I'm sure. Yeah, I mean, usually I don't know if they've found like the exact kind of cause of it, but what happens in a bulge is so like in between every segment of your spine, you have like a little cushion, which is your disc. And so they're
Mhm.
like little pillows or little shock absorbers. And so all around the circumference of this disc, you have it's kind of like the scaffolding or kind of like the reinforcement of it.
Mm.
Because the disc is a little squishy. It's like
Mhm.
you oftentimes hear people compare it to like a jelly donut, where you have like the the donut part of it being the structure of it, and the inside of it being a little bit more jelly
Oh,
like.
okay.
Um, and so what happens with a disc herniation or a disc bulge is like there's a weakness or an area of weakness in that wall going around, and so
Oh,
things will move path of least resistance, so it'll kind of like squish out the, in that
yeah,
weak spot,
that's what
right?
that does.
And so like you have like disc herniation or disc bulges. So disc bulge is where like you just have like a pooching out of the
Yeah,
wall,
like
where the
herniated, right? It,
yeah, a
in a way.
herniation is actually where it like kind of almost like squishes out, right? So it's like different degrees of kind of failures in that in that structure. Most of the time, it's when someone is in a flex position, so they're either bending forward or they're sitting. That's usually what will put the most pressure on the disc in like kind of like where it pushes out backwards.
Okay.
Um, and then there's sometimes where people will have like already have a disc bulge or a disc herniation and they might not have any symptoms, and then they sneeze and then they throw out their back.
That's what happened to me.
Um,
I sneezed
yeah,
so hard and then I could not
it
move.
probably yeah, it probably was something where you already kinda had it, or it's like kind of like the
Oh,
straw that broke the camel's back kind of thing.
interesting.
Um, yeah, and the interesting thing is that they've done a lot of studies at this point over the last, like, 10, 15 years, where they just took people who didn't have any back pain across the lifespan, so different decades and whatnot, put them in an MRI to see what the quality of their back was. And these are people who are like asymptomatic, no symptoms, no back pain, no nerve pain, no nothing. And what they found is that as each decade goes on, there's a higher percentage of people who have these disc bulges or disc herniations or other issues in the back as the decades go on. But remember, like these people all don't have any symptoms.
And all
So
different
it's
ages
always
and whatnot.
all different ages, yeah, and they categorize, okay, people from, like, 20 to 30, I'm just throwing out random numbers, but,
Yeah.
like, 15% people had disc herniations, and then 40 to 50, 30%, 60,
Wow.
etcetera. And so it kinda just goes to say that, and this is what I caution people about all the time, is, like, you never wanna look at a MRI or a X-ray or something like that and be like, "Oh my gosh, I have pain." Like, "Oh, my back
Right.
is so messed up, I have pain." It should be the other way around. I have pain, I have these symptoms, and then you look at the MRI, it's like, okay, well, that makes sense as to why you have this pain,
Yeah.
because I see that the nerve is getting pinched here, or you have degenerative disc disease, etc. Um, so I see oftentimes when people have back pain or something else, something completely unrelated, and they say, "Oh my gosh, I have arthritis in my wrists, and I never even knew that." And all
Right.
of a sudden, they start to have pain in their wrist.
Yeah.
Not to say that their pain is made up, but like psychosomatically, that could you know cause more areas of concern than they might have been completely fine the day before, not knowing that piece of information.
Interesting. And Alfredo has a comment. He says, I haven't played in years, but I fell at work and my shoulders
Ouch.
and back hurt from this injury. Sounds like it would. And his name's pronounced Borja. It is pronounced as H in Spanish. Okay, cool.
I
Thanks
was
for
gonna
that.
guess that, but
Yeah, I should have gone there. I speak Spanish. I don't know what I was thinking. And Dave Keener says, Drum Talk TV. I'm not. I'm not sure what that means. Maybe when I say tell us where you're watching from, he means he's not watching. I don't know. But for anyone out there, if you have questions, let us know. What you said about, the herniated discs and whatnot, that's like, never knew that. Um,
yeah.
I'm gonna, for myself, chalk it up to lifting kids back then, because by then I had 4 kids between the ages of, well, Steve, our producer, was 1, and or less, and that means the oldest would have been 8. Yeah, interesting. That must be
Yeah.
what it is. Yeah.
Yeah.
They
Yeah.
certainly wasn't doing hard labor or anything. That they were the hard labor. A couple of them still
That's
are. I
hard
won't
work.
mention the names. Yeah. Cool. What kind of advances have you seen either in the process of your physically working with people and or the technology over the last, say, 5 years, if there have been any, and what does that procedure or service most commonly treat, as far as whether it's carpal tunnel, whether it's surgery or avoiding surgery, or whether it's some other repetitive motion uh, ailment?
What do you mean by that? Like,
Well, like, has there been advances in how you would approach something now compared to maybe how you would have 5 or 10 years ago, whether it's with a technology or something you physically have
oh,
them do
sure.
or you do with them?
Sure. Well, I would say that as a whole, and I'm just talking within the realm of physical therapy, right?
Yeah.
Um, as a whole, I would say, and things kind of ebb and flow. There's always like phases and kind of general trends that people go through or kind of industries go through. The general trend right now,
Mhm.
at least in the grand scheme of physical therapy, is that people are way more encouraging of like early movement, meaning that like, okay, if you threw out your back and you were unable to walk, or it was like really painful to walk, or it's like just like really uncomfortable and debilitating. Oftentimes, maybe like 20, 30 years ago, the common practice would be like, okay, well, you just kind of like go lay in bed and like hopefully it'll ease up. Now, people are getting out and like being encouraged to move much, much earlier and much, much sooner, still within
Mhm.
the confines of like, okay, let's not like make it more angry, but like, let's do some kind of movement, just because what we see is that if you completely immobilize yourself, if you go bedbound after an exacerbation of low back pain, similar to what we were talking about earlier with
I was gonna
musicians
say,
taking time off,
yeah,
right?
and
You
then jump
actually
right in.
lose strength, you lose flexibility, you lose mobility depending on how long you're out for. And so, even people who have like wrist fractures or shoulder surgeries, like we're getting them moving like much, much earlier than the stand when I was working as a physical therapy over 10 years ago. It was like, okay, let's just keep them immobilized for 6 weeks, get them out, then start moving. Now it's
Yeah,
like, okay, they're still in a brace. They can start early movement depending on the fracture. Everyone's a little bit different, but
yeah.
like let's get them moving starting like week 3, week 4, so they're not so stiff when the fracture is healed and we can get things moving again. So I would say that's a really big trend. Like you'll see a lot more exercise based interventions versus in the past is more passive. People would do um, ultrasound or electric stimulation or a lot of like manual therapy, like where you have like kind of like your massage, um, as people kind of interpret it as like, which is still very valuable. There's a lot, but there's a time and place for that.
Mhm.
Um, so I think if you have someone who's like a little bit more uh, fresh out of school, I guess you could say, like you'll see probably be more likely to see them kind of trend towards the movement and exercise first and less so the hands on.
Interesting. Are
Yeah.
there body types that are more prone to certain types of repetitive motion. And when I say body type, I mean maybe if someone's overweight or really lean, or does it have more to do with their overall physical condition? Because of course someone could be overweight and have really wonderful strength and stamina and everything still. And
That's
then
a
my next
really
question after that would be about age. But yeah, what are
that's
your
a really great question. So there's two things. So I think you touched on one of them, and one of them is the conditioning that that particular person is in, right? And so it doesn't necessarily matter like their BMI or their kind of like just general body type, but it's like overall conditioning. How much force or how much work is are those tissues able to accept at any given period of time? The other thing that I always am interested in is so when we talk about flexibility, it's a spectrum of flexibility, right? And so you have your average person who's flexible or not, but then you have some people who are like really, really stiff and tight. And that could be just either A, how they're built, or B, maybe they're just stuck in one position where they're not stretching out of that position and their body adapts to being stiff and tight.
Mm,
But on the other end of the spectrum, you have people who are like very, very flexible. Like, you know, circus contortionists would be people on the very far end of that hypermobility
right.
range. But you have other people who are like double jointed or who can like, you know, put their thumbs like against their wrists, like just very, very flexible.
Yeah.
And so people on either end of the spectrum, either the very hyper flexible people or the people who are super stiff, would probably be more prone to
Mm,
overuse injuries. But again, it comes back to the conditioning, like how well are people conditioned because how they use their bodies on either end of the spectrum are very different.
that makes
So
sense.
people who are more hypermobile, and it could be like one joint is hypermobile because maybe they had like fallen and sprained their wrist or sprained their ankle or something. So that one particular joint is hypermobile, or it's like that's just how they're born, and so their whole body is, you know, very flexible. Those people who have hypermobility either in a joint or globally, they actually it's because the ligaments that connect one bone to the next might have a lot more play, might be a lot more lax, and so it allows for more motion to happen. So they kind of lack a little bit more kind of passive stability in their joints. And
Interesting.
so, yeah, and so then what ends up happening, or kind of the way that they function, is that they depend on their muscles to provide another layer of stability in the joints,
Mm,
um, in order to help compensate for the laxity in their ligaments. And so their muscles are working a lot in addition to doing the task, which is a lot. So that could, you know, contribute to overuse injuries.
that's
And
interesting.
then,
I'm
yeah.
I'm wondering on the age side if you see more injuries in younger people because not that they're not in great shape, but they're overdoing it. And maybe older people like me are a little more cautious or economizing their movement or something. Or what does that scale look like?
Hmm.
Age to injuries ratio or age to magnitude of injury ratio.
Hmm. Well, in my own practice, I can only speak to my own practice. I don't,
Mhm.
there have been studies that look at it, and those studies have shown that the bigger the age, the more likely they're going to have injuries. Um, but it, it's one of those like it depends kind of situations, right?
Yeah.
And so I work with a lot of young musicians, and by young musicians, I mean like college age to like graduate school. So I work in a music conservatory, and so I see people who are practicing 4 to 6 hours a day, right? And then in my own practice outside of the conservatory, I see, you know, the pros. So I see people who are in their maybe like late 20s to 50s is probably like kind of like the average age range that I see, and then I get, you know, some people kind of on either side of it. I think it's more to do with the volume of playing, like in terms of volume, like quantity of
Yeah.
playing, more so than like an age related thing. Because,
Okay.
yeah,
That makes
usually it's like someone, like if I have a drummer who comes in, like oftentimes it's like, "Oh, yeah, I was, like, working on this new lick. I was working on this new technique, or I was trying to, like, learn something different. I was practicing, like, a ton, and then I started getting this problem." Or I changed my setup, and I kinda reconfigure things, and I was practicing for a couple hours in that configuration, and now I have this
Yeah,
problem.
body wasn't used to the new
Um
setup.
Right, exactly, and then, like, versus, like, the kids that I work with, the students that I work with, it's more like, I had a performance coming up, or I had 2 performances in a row, and I was playing, like, 6, 7 hours a day,
Yeah.
right? So, to me, in my experience, it's more about, like, the quantity of playing versus an age-related thing, because I definitely see the whole spectrum of, ages.
Interesting. Thanks for sharing that. Well, we
Yeah.
don't have any questions today. However, I'll make sure that Janice has the link to the post. This is on YouTube and Facebook, so it'd be easy to find. Often, what happens is people see it a day, a week later, and they might throw a question in, and you're all welcome to. And Janice will track back from time to time and take a look.
Yep.
We will be doing a show next month, where in the meantime, we're going to be posting some promos asking you to send in, if you're so bold, we're going to ask you to send in pictures of you at your setup, not of your setup without you, but pictures of you at your setup that shows how you're sitting, how your posture is, what's the angle, if any, of your hip to your knee, where your femur
Yeah.
is sitting, how you sit, so that Janice will kind of rate whether or not you're more prone to eventually have XYZ type of injury because of this posture or this posture and that injury, or if your
Or
posture.
even, like, videos too.
Yeah,
Videos are
videos would be
valuable
great too,
too.
and she could see your
Yeah.
reach, and different things like that. I know a lot of drummers, being that we typically, unless you're playing with Rick Wakeman, typically have the biggest setup on stage, the biggest vanity instrument. Even a four-piece kit takes up a lot of space, right? But sometimes drummers set stuff up for show. It looks so cool to have the chinas up there, and then like Carmine and Vinny. Well, Carmine Appice and Vinny Appice, that's a whole other story why they pronounce their names differently. They've both had shoulder replacements because of that. So
Mm. Yeah.
we'd love to be able to feature you on this show, and it's like getting some free advice, right, Janice?
Yeah. Yeah, but it's not to be construed as medical advice, right?
Right. And if you want more of Janice and what she does, you can follow her at all the locations that are right in the text of the post. So you can check that out. I find the topic very interesting personally, which is why years ago I got with Nadia and we started making this as a Drum Talk TV original series, because I think it's
Yeah.
very important.
Yeah, I mean, obviously, I'm very passionate about it because this is, who I see day in and day out, and I want more musicians to be thinking about the physicality of them playing. So,
Yeah.
yeah, thanks for having this, because it's a really great thing.
Yeah, absolutely. And just glancing, our next show will be April 12th. That's also a Friday. And we'd love to have you folks on board in picture and video, and even on the live. So feel free to send stuff in at drumtalktv.com. There's a video and photo submissions. Well, it says video submissions, but you can submit photos there as well. But as Janice said, videos would be more helpful. And follow us on Facebook and YouTube, where this is live at Drum Talk TV, @ that is Drum Talk TV. And we're also on Instagram at the same location, and Vimeo, and X or Twitter, or whatever he's going to call it next week. Janice, thanks a lot.
All the
Hang on the
things.
line with me. Yeah, all of the above, right?
Yeah.
And thanks everybody for tuning in. We will see you again soon. Lots coming up with interviews and other original series. And be sure to check out our membership site, drumtalktv brilliance.com. Thanks everybody.